Good afternoon, colleagues. It is the last panel for today, and I assume that everybody is kind of slowing down, given the fact that the day was kind of pretty long, and we heard so many of the very interesting presentations throughout the whole of the morning and the afternoon so far. We are now at the panel session number 8, the contemporary examples in improving CRVS systems. We will have the presentations by Ani Mkhitaryan, the head, Office of the Civil Status Acts Registration Agency, Ministry of Justice, Republic of Armenia. Then she will be followed by Romesh Silva, a technical specialist, Health and Social Inequalities from UNFPA. Josie, Perez from the Philippine Statistics Authority, Deputy National Statisticians on Censuses and Technical Coordination, will then take over. Then we will have Ms. Vibeke. Ms. Vibeke is from Statistics Norway, and will also be presenting on the experiences of the tool that has been developed for the purposes of preparing vital statistics reports. We will have Omrana Pasha from Bloomberg School of Public Health, Johns Hopkins University, with the example of the sample registration survey. I do have here on my list Mr. Perez Director. And this is the same. Thank you very much. So I'm sorry for the confusion. It wasn't clear to me from the program of work. So we will be focusing on the contemporary examples in improving CRVS systems. And I will take the liberty to hijack the first 5 minutes and just to present in very brief the systems that we are developing, the model rather that we are developing for the purpose of this shift in the functioning of the civil registration and vital statistics system. This is where I actually stopped this morning. This is the model of the system that the United Nations is now promoting as a solution, as a holistic solution for the purposes of ensuring the civil registration of all the vital events in a country, that is translated into the three major streams. The first stream would result in the updating of the population register, which is the one on the down under the yellow, the yellow box. And then that will be translated, that will be served as an input to the ID management system, which will then issue biometrics identity cards depending on the age of the person as per the national law. At the same time, it will also translate into comprehensive, regular and annual vital statistics that have to be produced if we want to have the proper assessment of the population dynamics and other phenomena that are pertinent for the implementation of the 2030 Sustainable Development Agenda. So this is a shift in the way that the United Nations is putting the recommendations to all the countries. The recommendation now is that we need to develop this holistic approach between civil registration, vital statistics, and identity management, despite the fact that we, as already mentioned, do have to work on the international standards regarding the identity management, but nevertheless, we are witnessing that in a number of countries this is exactly what is happening as we speak, and we want to make sure that all the countries have a model before them and the good advice that will shepherd them into the right directions to make sure that all of the aspects of civil registration, which is the legal protection, which is the human rights, which is the legal tenders, are successfully achieved, as well as the production of vital statistics. We have been promoting this model through two major publications. The first is the Principles and Recommendations for a Vital Statistics System, Revision 3, and the second is the Handbook on Civil Registration and Vital Statistics Management, which is now available online. We are now in the process of putting it in hard print, and we have used these two major publications to run a number of workshops presenting this very model to countries in Asia, and now we are focusing on the countries in the North Africa and Arabian Peninsula. So this new model, as I said, is already functioning in a number of countries, most of Europe, essentially, as we have also heard here today. For example, Norway has the system put in place and is functioning a long time ago. What is really extremely evident as we speak is that it is taking hold in many more areas of the world, such as Latin America. We have Chile, which has an extremely elaborated and detailed example of the merging of these three functions of the government into one holistic operation. Peru is almost there, and the Guatemala is also developing a completely new set of not only legislative background, but also the agency that is supposed to take over the civil registration and identity management system under one roof. In Asia, we have examples of Vietnam, we have examples of Republic of Korea, we have examples of Malaysia. So all of this is telling us quite clearly that this is the model that can function, that this is the model that has savings incorporated in them, that this is a model that is worth recommending for all the countries in terms of ensuring that the delivery of the government functions, such as the civil registration, vital statistics, and identity management, is done in the most effective manner and rendering the most services for the countries. So this is very briefly where I stopped this morning. I just wanted to have the opportunity to share with you those examples. Much more of these examples can be found on our webpage. You have there the whole content of the workshops together with the presentations, and that might help you in acquiring a better understanding of the new recommendations coming from the United Nations. So this is, I will stop here. I just wanted to have this as a kind of setting the stage for the discussion that follows. We will have national examples here. We will learn how this works in real life in real countries, and also how this fits with what is going on from the point of view of quality assessment. How do we make sure that what we are doing can be measured in terms of quality? So with this, I will pass the floor to Ms. Mkhitaryan. Please go ahead.
Thank you very much, Mr. Mrkić. Good afternoon, ladies and gentlemen. Today I'm going to speak about, do you hear me? Yeah, thank you. I'm going to speak about innovating in civil registration and vital statistics in Armenia and how fast it has been in Armenia. First of all, let me to say that all achievements we have in CRVS fields is the result of demonstrated will and continually implemented policy of our governments to develop and to expand the e-governance system. Today in Armenia we have an original and really very flexible electronic base for connecting different state bodies and their function to provide a wide variety of services for our citizens, and not only for our citizens. From 2008 onward, and with the financial support from our state budget, and of course from the financial support of our international development partners such as the UN, EU, and World Bank, we constructed numerous electronic systems. As you may see on this slide, there is some problem. Which one? Oh, okay, thank you. As you may see on this slide, we created many electronic systems. It's not all we have, but this is main, which is useful for our people. And one of these electronic system is the Civil Status Acts Registration Unified Management System, which was created or constructed around our unified ID system. And today it has become a very efficient and toolkit to decrease the bureaucracy we had in this field and tighten time span. This accomplishment is the result of being connected with other electronic systems of different state authorities. From this slide, you may judge about the results and how expedited the implementation has been in Armenia. Namely, in 2012, we planned the process of e-civil implementation. In 2013, all territorial body in Yerevan, which is our capital, commenced the process of making registration of civil acts by using the piloted system. This was due to the connection of e-civil with the state population electronic register. From 2013 to 2014, e-civil was connected with the electronic system of the Social Services, Police and National Statistical Service. This period was also marked by the professional training of all our employees and with the technical equipments of all our territorial bodies and by the provision of high-speed connection, internet connection in our territorial bodies. In 2014, we also have full transition to the electronic management system in all our 52 territorial bodies. And currently in Armenia, there is no single registration act which is not generated through our electronic system. And what does it give us? I can tell you that this system allows avoiding double registration, which is really very important tool for have a more or less statistic. And of course, it helps our government to have a good policy making in social services. Surely, we have not stopped in achievement we have in CRVS. Today, e-civil is connected with the main electronic system and transfers the data online to the ACRA system, which is the Credit Bureau Social Services, e-health system, electronic consulate system, of course, National Statistics Service, and among others. In addition to providing the status acts on birth, marriage, divorce, and death to the National Statistical Service, the Ministry of Justice, and I would like to highlight that the Ministry of Justice has created its own statistical database. The new database provides you with the function of obtaining and viewing the statistic which may be of interest for the particular time. This is really very efficient site, and we will be very happy if you visit it, and we have it in English. You have, of course, you have take some information in English. Moreover, in 2017, our agency, through our ministry, made a recommendation to our government, which was incorporated in our government official program for 2017 to 2022. And I really do believe that this recommendation is deriving from regional action framework. And according to point 10 sub point 3 of our program, in the area of civil status acts registration, Armenian government plans to, by the end of 2020, ensure that each case of birth and death within the Armenian territory is registered by an act, irrespective of whether or not an application for straight registration has been filed. So what we have done for it and where we're heading to, first of all, in 2017, the Ministry of Justice designed and developed the e-health electronic system. And from June, all medical organizations in Armenia are preparing birth and death medical certificates only in e-health system. And nowadays, all prepared birth and death medical certificates are generated in e-civil due to connection our systems. And medical certificate for birth and death registration is no more required to show when you register your birth or death. It means that you can just come with your ID card and that's all you need to register the birth or death. The second point I would like to highlight is from 2017 September, we have a full connection of ECWIL with the social services, electronic management system, and application for birth benefits are generated at the same time with the birth registration at the ACT registration territorial body and are sent online to our social services. The application approved by social services online, and parents just need to go to the bank and receive their money. And I think that it's really very good stimulation to register the birth, because there is we decrease the bureaucracy, we decrease, of course, the spent time, and it's really very good, and it's working too. And what we are going to do. And what we are going to do. Based on medical certificates, a childbirth will be registered in the system on the basis of the information of child's parents without providing the child name and surname. The child name and surname will be provided upon provision of application to receive the child's certificate of birth. The state registration of death will be recorded based on the data of medical certificate of death. The certificate is to be presented together with the application. So it's our main plans for CRVS field, for improving CRVS field, but no one knows what we are going to create tomorrow. So maybe something new we will be, and maybe next time I can show you some new our steps or new our main goals we will have in these fields. I think that we are on the right way right now. Thank you very much. Thank you.
Thank you very much. Indeed, a very informative presentation that shows that things can be done, and that what essentially triggers those developments are the determination and the commitment of the government to ensure that the services rendered to the citizens are really automatic and they're electronic, they're simplified, and the bureaucracy is minimized, and the results are really outstanding. Thank you very much for the presentation, Annie. We will move now to Mr. Romesh Silva with the presentation on not this one.
Is it the one?
This is the one?
That's the one.
Oh, sorry. Go ahead.
Thank you, Srdjan, and also wanted to just quickly acknowledge and thank our generous hosts, and particularly Irena, who's here with us for the excellent conference that they've put on today and tomorrow. So I'm going to sort of focus a lot more on the production of vital statistics from incomplete and deficient civil registration systems. So, but it's worth noting that while vital statistics is an important output of a civil registration system, we highly value civil registration systems as a driver and protector of individual human rights and a promoter of social inclusion. But on the statistical side of things, and I think Srdjan nicely outlined this earlier today, civil registration systems are unique amongst population data systems, given they're continuous, permanent, compulsory, and universal. And that's something quite different to other key systems like population censuses and household surveys, sample registration systems, etc. In the world of vital statistics, and I'll focus a lot on this presentation in terms of death registration and mortality, we have, a paradox. This is data from what the UN calls the Western Asian region, or, the Middle East and North Africa. And the y-axis on the left-hand graph is showing you death registration completeness, and the x-axis under 5 mortality rates, and in the other graph on the right-hand side, it's adult mortality rates on the x-axis. And what it's showing here is that it's countries where we have high mortality burdens where we have actually the weakest civil registration systems, and in particular the weakest death registration systems. And this is further shown, when we move beyond just thinking about completeness of the death registration system, but also think about the quality of it. And so this is work done by that was published in The Lancet very recently, which looks at the variability across the world in terms of, in particular, death registration statistics, and looking at factors like, the quality of the cause of death reporting and the internal consistency of medical diagnoses, and the availability of vital statistics data. The key thing to notice is that for areas, particularly in sub-Saharan Africa and notable parts of Southeast Asia, we actually don't even have information about some of the quality aspects of death registration data. So I want to underline here by saying that our knowledge base even is quite incomplete in terms of the death registration completeness and quality around the world. And that's reflected in, vital statistics published by the United Nations. And this is, just sort of a summary from the last World Population Prospects published by the United Nations Population Division. And it shows that, a little bit less than half of the countries of the UN member states, their vital statistics, as reflected in the mortality estimates as reflected in the World Population Prospects are really drawn from complete vital registration data. Whereas for more than half of the countries, it's either derived from incomplete vital registration or, survey estimates or very heavily modeled estimates based on just an estimate of under 5 mortality from a recent household survey. So I'm going to focus the rest of the talk on 3 main issues, around the strategic opportunities for innovation in terms of producing vital statistics. I think the first area to think a lot about is what we can do to improve completeness estimates and demographic data quality assessment of available civil registration data. And the second is to think about the integration of multiple data sources alongside of civil registration data. And then thirdly, to cultivate a cultural norm around the world to prioritize routine vital statistics production and their usage. I was just in a session before the coffee break where our colleague from Namibia, talked about publication of vital statistics, but there isn't actually much of a demand in usage, even within the country, of the vital statistics outputs. And so I think we need to think a lot about that and make some specific interventions. So let's focus on improved completeness estimates. So this is data from the last the 2010 round of population and housing censuses, and what it's showing you is, the inclusion of a number of add-on questions about household deaths in the past 12 months, and there's actually a good cross-section of available data that can be used from the census round, the last census round, to estimate death registration completeness. But as we've been looking at these kinds of data, and for us at UNFPA, we're the largest financier and provider of technical assistance to the decennial census rounds in the world, we see that a number of countries that we work with, even after collecting that data, haven't gotten around to actually analyzing and publishing the results. So as we've moved into the 2020 round of censuses at UNFPA, our census strategy for this current round really focuses on focuses on three big areas: combining census data with civil registration data to foster the full use of population data across the national systems. And then secondly, to incorporate data usage, particularly at the national level and the sub-national level, as a focus of census support and, broadly speaking, civil registration strengthening. And then lastly, to try to better link data availability to data use for policymaking. Oops. Great. So so this is an example from Thailand where it wasn't quite using the census, but using a survey of population change. Colleagues have estimated the variation in death registration completeness at subnational levels through actual linkage, record linkage at the record level of reported deaths between the survey and the civil registration system. And apologies that the table's a little bit small, but hopefully people can see it. You know, the thing to notice is notable variation by sex and by age in terms of the under-registration of deaths. So in particular, you see a very high proportion of childhood death under registration. And, you know, but differences if you look across the age range from 0 to 14. And the only way we know this is through this direct record linkage, you know, which really unpacks that variability at age and across age and sex. Oops. So I want to talk a little bit about integration of multiple data sources to particularly improve completeness and underpin accurate vital statistics. This is a schematic graph from the Swiss Tropical Health Institute showing the potential data loss from the time of death notification through to production of vital statistics. And we see that in a number of places, you know, from notification of death through to actually officially registering with the local authorities, you know, assigning a cause of death and certifying that cause of death, that, you know, there's there's notable data loss across that chain. This is actually well reflected in recent work from Brazil. Here, what I'm showing in the table on the right-hand side is vital events, both deaths and live births, documented by different data sources in Brazil: hospitals, registries, primary healthcare units, funeral homes, official and unofficial cemeteries. And if you just glance down, you know, for example, the deaths column, what you see is that out of the total number of deaths that occurred in 2008 in this subnational area of Brazil, there's no one unique source which tells us the whole story. And so I think this analysis speaks to the importance of community-based systems speaking to each other and informing the official civil registration system. And then furthermore, not just in terms of informing the civil registration system for completeness, but in this graph, what I'm showing here is the work done in Brazil to adjust the actual mortality rate estimates. As you can see, that the sort of lower dotted lines in each of these 5 areas in Brazil is referring to the unadjusted rates. If you just took the civil registration data on faith versus the upper dotted lines showing the adjustment factor based on incorporating the additional data sources. And what you can see is there's certainly in a number of areas a substantial under-registration, a systematic downward bias, but you can even see, particularly in the 2 left-hand graphs, that there's even some difference in the slope of those curves, showing that, you know, the rate of change in mortality rates is also systematically biased for the death registration system. I want to close by talking a little bit about a need for a shift in how we think and promote routine vital statistics production and usage. And I think, Srdjan nicely outlined throughout the day the revision 3 of the principles and recommendations for vital statistics published by the United Nations. And I think that, to sum it up in just a catchphrase, I think there's a number of parts of the principles and recommendations which really speak to this, to a call that we analyze what we collect and we publish what we analyze. So let me unpack that a little bit with an example from the capital city in Madagascar. And so this is work done by colleagues at the French National Demographic Institute with local health authorities and civil registration authorities in Madagascar. What I'm showing here is not nationally representative data. This is only for the capital city. And what's fascinating is that this work was done a few years ago, and if you look at the left-hand graph, for example, of life expectancy at birth, you see in the mid to late 1980s, there was actually a mortality crisis in Antananarivo. And actually, at the time, this was actually not well understood and not actually clearly known by the public health officials in Antananarivo. And it was only realized many years later, once these vital statistics were produced from the public health authorities and National Statistics Office records. And so this is moved forward in terms of now routine vital statistics production for the capital city of Madagascar, even though the registration completeness in rural areas is very, very low. One can still, given the quality and completeness of registration in urban areas, there's plenty of opportunity here to produce at least vital statistics reports for capital cities and urban areas. And I want to close by emphasizing for colleagues from National Statistics Office, this nicely links with the fundamental principles of official statistics, which outlines, principles around honoring citizens' entitlements to public information and statistical authorities facilitating the correct interpretation of data. That speaks to the earlier examples from Brazil of the need for adjustment of deficient and incomplete civil registration data. And then lastly, that data for statistical purposes may be drawn from all types of sources, be they surveys or administrative records. And so I think we are in an era where there's a call around the 2030 agenda for a data revolution, but unfortunately some of the earlier slides that I presented showed that while there are some good civil registration systems, a lot of that data is not actually making it into routine vital statistics reporting. And I think we need to change that. Thank you.
Thank you very much, Romesh. Thank you for bringing up at the forefront the issue that is really critical, and this is the production and the usage of vital statistics coming from different sources. And this is also in the line of ensuring that the switch to the different models of civil registration vital statistics does not result in neglecting the production of comprehensive, regular and reliable vital statistics. Thank you for that. We are now moving to the Philippines, and we will have Ms. Josie Perez, Deputy. Yeah, please. No, that's perfect.
Okay. Good afternoon. I'm going to present the progress on civil registration in the Philippines. Okay. Let me have some historical events. Starting in 1898, the CRVS started in the Philippines, and from 1901 to 1999, there were several laws enacted. One is the Civil Registration Law of the Philippines, and the other one is the Local Government Code and the Family Code. And during this time, typographical errors in the civil registers were corrected through court proceedings. And then starting in 2000, in order not to, because there is a problem in the court proceeding, it delays the correction for several years. So starting in 2000, several Republic Acts or law was enacted in order to correct the clerical or typographical errors, and also the legitimation of children born to parents below marrying age, and also the allowing also the illegitimate children to use the surname of their father, amending the purpose of the Philippine Family Code. Okay, and also okay, I'll go back. And during this time, from 1901 to 2000, there were also low civil registration rates. So what the statistical office was partnered with, collaborated with the local government in order to improve their registration, and that the mobile registration was established. And also every other year there is a workshop or a forum for the statistical office and the civil registrars to discuss the issues regarding civil registration, and as well as the revision of the different civil register forms like birth, death, and marriage is being done led by the statistical office in coordination or collaboration with the local government units. Okay. Now, Okay. Now, in 2000, there was a problem of everything was done before 2000, everything was done manually. Okay, registration and even the services of the statistical office is always manually getting the books from different files, and this caused a lot of problem, loss of or misplaced documents. So sometimes most of the documents being requested by clients are negatively they receive negative response from the statistical office, and this caused a lot of problem for for the Filipino citizens. And at the same time, it made since we have a centralized civil registration services in the statistical office, there was a long queue. And this made the president of the Philippines worried, because he thought that every day there is a rally. There was a rally or in front of the statistical office. So what the head of the statistical office, this led the head of the statistical office to have a public-private partnership. And one big company, a multinational company, Unisys, took the challenge and partnered with us, with the statistical office, and established the Civil Registration System Information Technology Phase 1. The project was supposed to be only for 12 years, but it was it was supposed to be, it should be 12 years, but it was extended until March of 2017. And then during the 2016, we started the bidding for the second phase of the CRVS ITP 2. Okay. And then this is also a public-private partnership. And out of the 3 bidders, only 1 bidded, and that is also the Unisys. Okay. So the project will run for 12 years, and for the first 3 years, they are creating all the programs for the improvement of the system. Okay. The comparison between the CRVS ITP1 and ITP2, before the copy issuance, we can release it now within an hour, the authentication within an hour, the certification of no marriage within the day. Before it's 5 days. And then we have a new one, certification of no death, okay, for a person who were thought that he is already dead, but it's still alive, then we can certify. We can provide a certification of no death within the day. Okay, and this is a new the premium annotation or the correction in any civil register. Usually, it took in the CRS-ITP1, it took it about 12 to 15 days. But within the CRS-ITP2, it will be 5 days. Within the PSA, as long as the document is already within the PSA, then three systems will be included in the CRS-ITP2. That is a viewable online document and doc print from viewable document and transaction verification and agency validation service. Okay, and then for the CRS-ITP1, we had 40 PSA operated outlets. It's no longer centralized, but we had our partner established 40 operated outlets, but in CRS-ITP2 it will be doubled. So almost a province will have its own operated outlet, CRS outlets. And then in CRS-ITP2 we were provided CRS building, about 9,000 square meters, and this is where the the main outlet will be established. And then we have also in the CRS-ITP2 we have the disaster recovery online and fully synchronized disaster recovery site. This is the new building, the new CRS building under the CRS-ITP2. Okay, and this is the example of the design outlet under the CRS-ITP2. Okay. Now, we have other innovation for data quality. One is the duplication method. This is to eliminate the duplicates of any civil register document in the PSA database, because there are some individuals, or if ever there is a error in their civil register document, they register again and they thought that that will correct their document. They didn't realize that the original document will prevail, not the second registration that they did. Okay. Then linking the birth, marriage, and death document of an individual, which will be used for Social Security, insurance, and other benefits. The second one still being discussed on how this will be done, because there are some claims, even though the person's already dead, okay, they still continue to claim some insurance benefits. So that's why the Social Security and health insurance are asking the companies are asking the PSA to do the linking of the birth, marriage, and death documents. And then for the accuracy of the death documents, we use the analysis of causes of national death for action, which or what they call as Anaconda. This is a tool for checking the quality of mortality and the causes of death data in the death documents. It checks the population data, mortality data inputs, and so on. And then the use of the IRIS, it's a tool which provides interactive coding software specifically developed for coding of causes of death and to select the underlying causes of death. Thank you very much.
Thank you very much, and congratulations to the Philippines. This is a really huge effort, taking into consideration the size and the geographical distribution of the country with so many islands and so many other geographical challenges. We wish you good luck and to persevere in innovating the system. We are now moving to Ms. Vibeke Nielsen. Please, you have the floor.
Thank you. Can you hear me? Yeah. So I'm going to talk about some of the work which has been done on getting more vital statistics reports produced throughout the world. I'm from Statistics Norway, and we were approached by the UN Economic Commission for Africa and the UN Economic and Social Commission for Asia and the Pacific to produce a template and a guideline for how to produce vital statistics. And the purpose is to kind of make it more practically and more available for countries that do not have experience with producing vital statistics based on civil registration. So it's all based on the principle and recommendations by the UN, but it's trying to make it focus on some of the key issues, and it's really providing a kind of a template document which can be used and replicated by the countries. Yeah, so it's a template. But it also has a guideline part where it provides some introductions and some general information. And throughout the template, there are also a lot of boxes with information. It's both examples from other countries that have provided some having experience, but it's also general recommendations and suggestions for what to look into, how to calculate different indicators, and so on. The document is basically finished, but there have been some delays in the work on the layout. We expect it to be finalized this week so that it will be available, the last version, online starting from next week on. Based on the work with the templates and the guideline, there was also the two commissions again, so the need to also provide regional trainings. Because many of the countries still wanted to have discussion partners, they wanted to learn from each other, and they also wanted to kind of get some more practical input to their own data and so on. And it is also a good opportunity to get the different agencies in the country to sit together and to work together. So ESCAP was the one who initiated this work first. They developed a program where the countries were asked to provide experts both from civil registration offices, from national statistical offices, and where it was relevant from Ministry of Health or from Ministry of Justice. In the Asia and Pacific region, we worked together with the UNFPA, the national offices. And we are currently also providing the same set of trainings in Africa, where we work together with or where ACA is also hosting and organizing, where we work together with UNSD, with Plan International. And the Bloomberg Data for Health has been an important donor. In the future, I see that there are also other partners interested in joining, so it might become even broader. I already said some of this, but it's always a national team selected. And that's a requirement also that the countries that participate have a team that works together and that they decide who is going to join the trainings. They need to prepare data and information before the first workshop. There are 2 workshops. And the goal and the expectation of this program and the setup is that the countries finalize and, where possible, also publish a vital statistics report at the end. There's continuous work with the focal points to actually develop and improve these reports. What should be said, the goal is to use civil registration, but it's not always possible. So in many of the countries, we've used a mixture of different data sources where the civil registration data are not good enough, or where there are challenges, or where other data sources can complement and provide better information. Key elements: sharing data, assess the coverage and completeness, analyzing the data to produce key indicators and statistics, And I think what we've learned from the workshops, which was also part of the intention, but which we think has been going even better than we thought, is actually how the countries enjoy sharing experience and learning from each other. The most recent workshop we had in Africa, actually, a lot of the countries were supporting each other and giving each other input. And I think some of them learned just as much from that as they learned from us presenting the work in general. So some of the results so far, as I said, the document is soon available, the templates. We have finalized the program for the first 8 countries in Asia already, and all of these countries have now almost finalized their reports, and most of them have also published their reports. The Africa setup, we have only done one of the workshops so far. The next one is upcoming. But we have already started to receive drafts from many of the countries, which is great. It looks like there is going to be also a possibility of finalizing and publishing many of the reports at the end of the setup. There's already discussions about more trainings. We're also working together with UNSD, as Srdjan was saying, on North Africa and Arabian Peninsula, kind of trying to give some input there as well on the possibility of using the guideline and template and giving some input on how it could be used. But there's also in Asia and the Pacific, there's also discussion to focus more on the dissemination part, and there the Data for Health Initiative and Vital Strategies will have an important role in working together with us to find different ways of publishing the information, accessing or working towards different kind of user groups, not only developing a report, but maybe also policy notes, some core infographics for the population in general, and so on. So we will see what comes out of that. Thank you.
Thank you very much, Vibeke. It's always good, essentially, to emphasize again that even if the white civil registration is incomplete, that the data have to be used, and this is exactly in line with what is, again, in the international standards, and giving these tools to the statisticians will essentially make the statistics being used. And this is one of the major, as Romesh pointed out, deficiencies that we have identified in the previous period of time. Even when the incomplete data are available, and even if they are published, they are not used to the full extent. And using them to the full extent is essential for making profound inroads in first ensuring that the skills are upgraded, and also that the data are used in the full extent. So thank you very much. And now we are passing the floor to Ms. Omrana Pasha. Please go ahead.
Thank you very much. I'm actually presenting on behalf of myself and my colleague, Dr. Nayani, who's based in Kabul, talking about the establishment of a sample registration pilot site in a conflict zone in Afghanistan. So we actually are at the other end of the spectrum from Norway, where Norway is one of the Scandinavian countries, has centuries of excellent data to look at, and Afghanistan, despite the fact that the first civil registration was back in the 1800s, has very little data to bank on. And we have, and starting from that premise, been working there since 2013 to, how do I?
Yes, this one.
Oh, okay, thanks. So we are basically trying to come up with national vital statistics in the absence of civil registration systems in Afghanistan. In 2002, the School of Public Health at Johns Hopkins conducted a survey on maternal mortality in 4 districts in Afghanistan, including Kabul, the capital city, and Ragh district in Badakhshan, the province which I'm going to be talking about. And they found that the highest maternal mortality ratio anywhere in the world ever recorded was in Ragh district of 6,500 maternal deaths per 100,000 live births, which is just absolutely astounding. Over the period of the Millennium Development Goals, however, Afghanistan has made significant progress in improving maternal and newborn outcomes, but really has been hampered in their accurate measurement because of the lack of any system for measuring these vital statistics. And their estimation depends on mechanisms which are largely recognized to be poorly reliable, such as facility-based statistics, particularly in case of a country like Afghanistan, where more than 50% of deliveries take place outside of healthcare facilities and even outside of the presence of any delivery attendant, where many women are delivering by themselves or with family members. Other sources of data which the Afghan government has used and has been contributed to by other international partners have included national and subnational surveys and the use of and the development of national estimates based on statistical models. But the problem has been for Afghanistan, particularly in the area of maternal newborn health, that while the newborn mortality statistics from different surveys and also from the statistical models are all fairly congruent and moving in one direction, the estimation of maternal outcomes has been very, very difficult to pin down, and different models and different surveys have given very conflicting types of results, so it's very hard to know in which direction we are truly moving. So keeping all of those things in mind, with support from Global Affairs Canada, we have attempted to establish a mechanism for more accurate estimation of maternal and newborn outcomes in Badakhshan province in the northeast part of the country. So the objective basically was to establish a registry system which could quantify and illuminate the trends in pregnancy outcomes in a defined geographic area in selected districts in Badakhshan over time, and to ascertain population-based statistics on stillbirths, neonatal mortality, and maternal death through the implementation of a prospective population-based active surveillance system. So if you look at Badakhshan, there it is in the northeast of the country, bordered on one side by Pakistan and on the other side by Tajikistan. And it is a province which has districts which are urban, fairly urbanized. The capital city, Badakhshan, of Badakhshan, Faizabad, is one of those urban areas, and they're highlighted in yellow on this map. Then they have the semi-urban areas, the rural areas, and what are known as the deep rural areas. This includes the district of Ragh, where the greater than 6,500 maternal mortality ratio was recorded almost 15 years ago. So we have initially, truth be told, we selected Badakhshan for this work because this was one of the most stable and conflict-free provinces in the country. This was way back in 2011. But since then, and from the time that we actually got the work started on the ground, the level of insecurity in the province has been rising, and currently about 20%, close to 20% of the province is under conflict situation, where parts are completely outside government control and under insurgent control, and parts are conflict-ridden and where there is ongoing conflict. are areas where we have attempted to establish the sample registration system. In 2000, and this is the security map from 2015-2016, the red area, the ivory areas are those where the sample registration system is in place, and the red parts of those are those which are in active conflict. And actually now the whole of that district that you see on the right side, Shohda, is now controlled almost entirely by insurgents. So basically, Badakhshan province has a population of just short of 1 million people, and our surveillance sites cover about 1/5 of that population, and including 253 villages and 41 healthcare facilities. In order to do this work, we did what was initially a very simple approach, but then supplemented it with more technology. Initially, we obtained a listing of villages and neighborhoods in the selected districts from the provincial government. And then field teams visited each village or neighborhood to confirm its geographical location using global GPS device and to ascertain its correct name, etc. Then we marked the location coordinates for every map onto a satellite map, and then looked at what clusters of houses were present on the satellite map, but were actually never listed by the provincial government as having human habitation. And that way we were able to come up with a very comprehensive list of where people were actually living, which had not existed prior to our activity. In each one of these areas of habitation, the community leaders were taken into confidence, and an assessment was made about the feasibility of gathering data on an ongoing long-term basis. Then, as a second step after the mapping, a household survey was conducted where every household was visited as feasible given the security situation, and basic demographic information about all the residents of the areas was collected, including identification of all women of reproductive age and married women specifically. And since then, that was way back in 2013, since then we have been engaged in active surveillance for pregnancies, deliveries, and post-delivery outcome of neonates and mothers. And our registry teams visit every village or every neighborhood at least once a month. All the pregnant women at each visit are enrolled, and then with the goal being that every woman should be registered by 20 weeks of gestation. Subsequently, and an attempt is made to estimate the best possible expected date of delivery. And registry staff start to contact the woman approximately a week prior to delivery to ascertain whether she has had the birth or not. We encourage families, delivery attendants, and healthcare facilities to report to the registry staff each time a birth occurs, and then the registry staff visit the women and their babies. Again, all of these things are dependent both on the level of insecurity in a given area as well as weather-related accessibility, because this we found was the second major challenge as we did the work, that about 1/3 of our area under surveillance have roads that are completely impassable for 3 to 4 months every year due to the snow. So these are basically some of the maps that we made from the 4 areas where we are working, including these 253 villages or neighborhoods that we identified. 31 of them were found to be insecure, and out of these 22, the security situation was judged to be too precarious even for a simple visit or household survey. And the remaining 9, while we did map their coordinates and collect some information on the household survey, but surveillance activities could not be sustained. So about 85% of the area is under active surveillance, and the other 15% is out of bounds because of the ongoing conflict. So in this period of about 4 years, we have registered almost 25,000 pregnancies, of which birth outcomes have been ascertained up to 40 days postpartum on close to 95% of them, of the women who have delivered. And very few deliveries have been missed. However, there have been some delays, again, because, as I said, we don't visit when there is active conflict. We can't visit when there is when those areas are snowed in. But our key findings and conclusions, other than the data that we've generated, is that we have been able to actively identify pregnancies and births with substantial efficiency, despite ongoing and increasing conflict with the buy-in from the local population. That conflict situations are linked to poor pregnancy outcomes, and women who deliver on days when there is active fighting in and around their areas are 50% more likely to have a poor pregnancy outcome, and that delays in registration and poor pregnancy outcome are both closely linked, with both security and weather-related delays being linked to poor outcomes for neonatal survival and for timely registration in the registry system.
Thank you very much. Thank you very much for this really very dramatic example of trying to collect the basic statistics in conflict-ridden areas, and we congratulate to this effort. It is really remarkable. And I believe that those conclusions that we have in front of us speak for themselves, and that they do not need any additional comment. We just hope that the situation might improve sooner rather than later. With this, thank you all to all the presenters. It was indeed a kind of very welcome mix of experiences that we have had the opportunity to listen to. We have around 15 minutes for the comments, questions, and suggestions. So I'm opening the floor for questions to any of the presenters. Yes, please.
Thank you very much, and thanks to all the speakers. Some really interesting insights and very varied presentations. Specifically to Omrana, I've got a question about the programme, very interesting. Just a little bit more detail, really. Just a couple of questions. So, one, you talked about your surveillance agents, kind of who did you use and why, and how many of them were there for the coverage that you had. Then kind of a question around cost. To maintain this, and kind of what the potential for scalability is based on those numbers and those costs. And then the last point, it sounds like there's obviously still a problem to be solved there in that in the areas that security is still a challenge and weather is a challenge. Are you exploring those types of solutions, or have you had any ideas? Thank you very much.
Well,
thank you. We'll take some more questions and then we will address it. Yes, please, Raj.
Yeah, this is a question to Armenia. There are two questions actually. What I saw in your presentation was that the Ministry of Justice compiles the statistics, vital statistics, which will you confirm if they have a full-fledged statistics division within the Ministry of Justice? Or who compiles? Who is actually cleaning the data and then finally looking at it and finally providing it for release? So that's one question. And the interesting part was your new approach in terms of allowing registration of children without a name and surname. Why was it necessary? Because I know it is necessary, but what prompted this? What was the problem that prompted you to do this? Because this is a good step, I should say, but what was the problem?
Yeah, thanks to the panelists for the very excellent presentations. I have a specific one for Josie. coming from the Philippines. So I think we're all familiar that Philippines is a middle-income country, and you showed very nicely how there's kind of different phases for the evolution of the civil registration, the vital statistics system. And so I just had a question about the financing, if it's all right, just to have a good idea of how this vital statistics system has been financed over the course of this period of time. And then also, because of how we do see these different phases, how you were able to advocate with some of your colleagues working in Ministry of Finance or other places in order to mobilize these resources, because I think more and more a lot of us understand the utility and value in these data, but oftentimes we're working with counterparts who aren't routinely familiar with the data, and so just understanding different ways to advocate successfully would be very important. Thank you.
Yeah, thank you very much to all presenters. My question goes both to Armenia and Philippine. I would like to understand, because at some point, in the process, you all digitalized the system. So I would like to understand how you went about, all the previous existing archives or data. How have you been able to manage? Because from what I understood, the data were either not complete or difficult to use. So how did you go about that? Thank you.
Thank you very much. I believe that we have accumulated quite a few for the time being. So please, would you provide your answers?
Thank you so much for your question. We actually recruited people who were local to each district that we were working in. And each district, depending on the population, is covered by a single team, except for the central district of Faizabad, because of the large population, has 3 teams working there. Each team consists of a pair, a male and a female, which is very much in line with local culture and norms. And that pair is either husband and wife, father and daughter, mother and son, or sister and brother. That allows them to travel independently. Many of these women, unfortunately, are illiterate because it's hard to find literate women there. And so they can enter and talk to the mom and then report back to their male counterpart, who then completes the paper form, without which it would be impossible for them to. So this is a system that we've developed, which is in line with local norms, and this is really what's allowed us to continue to do this work despite the difficult terrain and difficult situation. The second question about cost and scalability, we have looked at the cost of this and compared it to other sample registration systems and find that the cost is very comparable to the cost of the sample registration system being used in India and also in China. And so currently we are advocating for the upscaling of this to a sample registration system at the national level. And we've been working closely with the Ministry of Public Health in Afghanistan for that purpose. And we're hopeful to see where that goes. Finally, regarding the conflict areas, I think, when we first started, we were more timid than we are now. We said these areas are really dangerous, nobody will ever go there, and we excluded them to begin with. And I think as we have spent more time on the ground, we've become more brave. And now villages which we would have never made it through the first round of screening are now routinely under surveillance. So given that, we're reconsidering our view about whether those 15% are truly inaccessible or not. And I think that, as I said, when we started, some of those areas were under government control and non-conflict, but now they're either under insurgent control or in active conflict, but our surveillance in those places does continue.
Thank you very much. And just to acknowledge, I really think it's an incredibly innovative approach to obviously a really clear problem, so it's great to hear the example here. Thanks.
Thank you.
Thank you for question. First question about database. I would like to say that it's not classic vital statistic we have in our site. We are not in charge in vital statistic. It's absolutely separated organization. We have a national statistical service, and they do all statistics. But at the same time, we have an agreement with our software company because all our acts are absolutely available to our agency. We decided to show just some information about, for example, if you visit, you can see live birth by the place of usual residence of mother. You can find the information. Live birth cross classified by live birth order or interval since last previous live birth. It's not classic vital statistic. We don't do it. We just give some information.
But it's very classic. Yeah, it is very classic.
I think, but I'm not sure that we are the specialist of here. We just collect some information and do it, and our statisticians they agree with us. It's not bad anyway. And the second, about children registration. Armenia, I have to say that Armenia have no problem with registration, really, due to Soviet Union, because we have some responsibility in it. And, of course, due to child benefits, we have any problem here. But at the same time, we decided to do this step to have this main goal for us and try to reduce any problem maybe we can have in future. Who knows? No one knows. But electronic system allows right now to do it, and we decided to do it. That's all. Okay. And about digitalizing. We started digitalize since 2014. Our paper archive starts from 1924 and includes approximately 10 million documents. We started digitalizing, but we need really profound. We need too much money for it, because it's really very expensive. Anyway, we try to do it in daily work. I mean, I have an order for all territorial body for digitalize 1-2 paper archive. I want to act, and it's of course it's helpful. But anyway, we need much more money for it, and it's a really very big problem. And I hope that we can find it. I really hope.
Okay. In both phases of the CRS Information Technology Project, the DOF, or the Department of Finance, is a partner, was part of the committee. Okay, and they are the one who approve the proposal for each of these projects. They headed the investment coordination committee. They chair that committee along with the National Economic Development Authority and some line or cabinet ministries or department. And the proposal was presented to them, and they approve it. But during the first phase, there's no bidding done, okay, because it's the first one. So they allowed it to be whoever the international, the foreign foreign companies would like to take the challenge. Then the first one who took the challenge was the UNICEF. So they really prepared a lot for this phase one. But in the second phase, we were told to conduct a bidding. So we have a bidding committee headed by the headed by the deputy national, the two deputy national. I was included in that one. And then we have below the bidding committee, we have the technical working group. And in each of these, in the bidding committee and the technical working group, a staff from the Department of Finance became a member was part of the membership. Okay, and then when only one of the 3 bidders bidded for the final one, for the final during the final meeting, we presented to them the bidding, the different amounts. Actually, it's not really a total amount that was bidded by UNICEF, but different components. Okay, and there is an agreement for each of the component. There is a counterpart for the government and counterpart for the UNICEF. But the second phase is much better than the first phase. Okay, and because there is a counterpart from the government, we presented that to the Department of Finance, together with the Department of Budget and Management, and they agreed. So they agreed with the proposal of the UNICEF, and so the government provided funding for the PSA as a counterpart of that second phase of the project. Now, when it comes to archiving the documents of the civil register, okay, first we had a grant. We were provided, I do not know the name of the international organization, because that was in the 90s. And together with the University of Utah University, we were provided with microfilm. And all the documents were put in the microfilm, and then one backup copy was given to the Utah University for archiving. But during the time when it was already the part for the UNICEF, we have also a backup copy. We use scanning methodology, no more of the microfilming, and also encoding some of the results from the different civil register documents, and those that were encoded were put in a database as a data file, but those that were scanned were used by the UNICEF in providing services to the Filipino people.
Thank you very much. Thank you all. I believe that we have reached the time to call this panel finished. I would like to express my appreciation to all the presenters and all the participants. I believe we really did benefit from very different approaches and really a kind of a full spectrum of the possibilities and the innovations that can be identified and applied in a number of circumstances, including the most difficult of all, like in the active conflict areas. So thank you all very much. With this, I'm closing the panel. Thank you.